Seaside FM.
And welcome back to the Dartmouth General Hospital Radiothon, supporting Dartmouth General Hospital Foundation. This hour is supported by Andy Solar Realty. And a reminder to our listeners, if you would like to donate to the Hospital Foundation, give them a call on the pledge line. It's 1-833-768-3443. Or you can do it online as well. Just go to dghfoundation.ca. And remember, every donation counts. The hospital is always there when you need it most. And we're very lucky today to be joined by a staffer at the Dartmouth General Hospital, Dr. Todd Howlett. He's here in the studio with us. And Dr. Howlett is the Interim Central Zone Executive Medical Director, Chief of Staff at Dartmouth General Hospital, and Provincial Medical Director of 811. You're a busy fellow, Doctor.
I am, Blaine. It's a great pleasure to be here with you. Thanks for having me.
Well, thank you, and thanks for coming in. Give us a brief description of your role at the Dartmouth General. I said you're a busy man, but what do you do at the hospital specifically?
Yeah, well, first and perhaps most importantly, I'm an emergency physician, so I still work at the emergency department, and you might see me
I've been there once.
Yeah. And then I have a leadership role, so for the last 12 years or so, I've been the Chief of Medical Staff of the Dartmouth General, and since January, I've stood in as the Executive Medical Director for the whole zone. So there is somebody else filling my position at the Dartmouth General, but the Dartmouth General is still dear and near to my heart, of course.
Now, because of COVID-19, a lot of things have changed. How we go to the doctor, we do a lot of it by telephone now. Do you think that that is going to prevail even after we kind of get COVID-19 as much behind us as we can?
Yeah, no, it's great. It's a great question, Blaine. I mean, it's been challenging, and during this time we found some better ways to do things, and some of these better ways we need to continue. And one of them you just mentioned, and that's virtual care. It probably makes no sense to have to go see your family doctor for a simple refill or just to review a blood test, and be able to do that over the phone. I think it's better for everyone.
Yeah, it's better for the patients as well. It's less time consuming for both, for the doctor and the patient, so it's a good thing. And I understand there is a COVID-19 unit, if not already existing at the Dartmouth General's, being developed.
Yeah, if you mean the drive-through, is that what we're talking about? So yeah, there's a novel, innovative setup next to the Dartmouth General that was supported by the foundation and has changed the way we do things. So we figured out early on that it might make sense to test people in their car, and we created a drive-through setup next to the Dartmouth General, and that's been quite successful. We've trialed it. The feedback has been very positive. And we've also done it not just for COVID testing, but for blood work. So one of the things we've been most challenged to do is actually draw blood from people because of the COVID requirements, cleaning space and the like. And we came up with the idea, and it was actually one of my colleagues, Paula Bond, came up with the idea, why don't we do it through the drive-through? And we did. We tested it. Patients were a little skeptical at the beginning, and overwhelmingly were positive about the experience. So going forward, this is another thing that we hope, even after COVID, that potentially we'll put this in place through this innovation and have blood work drawn in your car. So you could have a drive-through blood drawn experience, which sounds a little strange, but patients self-reported that they were more comfortable. They even experienced less pain. They appreciate the convenience. Imagine if you had grandma or somebody and you had to bring her into the hospital, and if she could be in the car and get her blood work done right there. It's just so much better for patients.
Yeah, I think it was back in June. I was tested for COVID, and I did the drive-through. It was quick, easy, and efficient. I was in and out of there within a half hour.
Yeah, no, absolutely. It's a great experience, especially for the patient.
Yeah, I don't mean to dwell on COVID-19, but it is current, and it's useful to speak to our audience about that. But what about the hospital itself, all the other services that are available there? It's quite a complex and quite unique as a community hospital in Nova Scotia, is it not?
Well, we often say it's probably the third busiest adult hospital in the province after the QE2 and Cape Breton. There's a lot going on, and there's been a huge investment recently by the government, $150 million, and the foundation was a big player in that, and that will advance a number of services there, particularly orthopedics. So, and as you may know, outside the hospital, you see this big sign, the Fred Smithers Center of Orthopedics. So there's a real dynamic group focused on knee and hip replacements, and we expect to be doing a large number in a highly efficient way at the Dartmouth General. And the foundation's been a big part in supporting that.
As a medical professional, how important is it to you who works at the hospital to have the foundation solidly behind what you do there?
Yeah, no, I can't say enough of things. The partnership we have with the foundation and all the foundations across the province, but particularly in this case, the Dartmouth General Foundation, is key. And without the foundation, quite frankly, we would not be successful. So, and that's for all kinds of reasons. One, it raises the profile of the hospital. It gets the message out. We truly partner with it. They sit in on some of our operational meetings at the hospital, and without the donations of the hospital, and I remember just yesterday or the day before, the chief financial officer for the province of the Nova Scotia Health said at least half of the equipment bought across the province is paid by the foundation. So there's a lot going on. The foundations are integral and integral to the functioning of the hospital. Without the foundation, we wouldn't be able to run the hospital.
I know across the province, some of the smaller hospitals are struggling, and if they had a foundation like the Dartmouth General Foundation, it would be a little easier for them. So Dartmouth is a wonderful example for the rest of the province, isn't it?
Yeah, and there is other great examples across the province, and it's the partnership, and it's a two-way partnership. We help the foundation helps us, and it's another way for us to connect with the people of the community. They can connect tangibly. The donations to the foundation go to big dramatic things and little important things. It is impactful, and it affects patient care in a real and significant way.
Finally, Doctor, I want to thank you for coming in, but before you go, can you give our listeners 2 or 3 good reasons why they should donate today?
Yeah, of course. So we were just talking about this. I was reflecting as I was going to do this meeting about some of the things that are there. I'm an emergency physician. I'll give you one example. Way back when Dartmouth General was at the leading of doing what we call bedside ultrasound. So normally you do ultrasound in the X-ray department, and somebody would have to be called in. At the Dartmouth General, we learned early on, this was years ago, and it's become the standard of care now, that an emergency physician would have a portable ultrasound machine and would be able to use it to improve your care, diagnose critical things, insert lines more safely. And it was the foundation that actually allowed us to move in that direction and become a leader in the province and nationally on bedside ultrasound. So the Dartmouth General, I'm quite proud to say, not only did we improve care there, but we actually trained people across the province and even across the country to do bedside ultrasound. So that was huge. So that's a big, impactful thing. During COVID was scary for all of us. When people came into the hospital, and especially elderly people and the like, oftentimes because of visitor restrictions, they couldn't have family members with them. So a smaller, impactful thing that happened was we had the foundation fund iPads, and through iPads they could FaceTime and see their loved ones while they're in the hospital. So there was at the Dartmouth General, we always talk about not only do we want to provide excellent care, but we want to provide in an excellent manner. So it's scary enough to be in the hospital, and you want to be able to be connected with your family members. And there's an example of giving money that allowed a family member to be connected, or a patient to be connected with a family member. Really, really important.
Some good reasons to donate to the Hospital Foundation.
Indeed.
Thank you, Doctor, so much for coming in today. We've been talking with Dr. Todd Howlett. And as a reminder to our listeners, you can donate by calling this number, 1-833-768-3443, or you can go online and get to us at dghfoundation.ca.
Thanks, Blaine.